Second part of the T-Spine PowerPoint is about evaluating your images. So we always want to see evidence of proper collimation. On the APT spine, you want to have your marker at the top because that's where the smaller vertebrae are. Remember I told you from the top to the bottom, they go from smaller to larger. So up at the top, you're more likely to keep the marker out of the way. Your marker, unless it's above the top rib, is probably going to be in some anatomy on the rib, but just be really careful that you're right at the edge. I'd prefer that it's up above that so that it's not in the rib, but if it is, it's not something that I would not give you a competency on. We just talk about where the marker should be, okay? Or you can tell me where the marker should be. I shouldn't have to tell you. All 12 vertebrae need to be on there. They should be uniform brightness and contrast. If they're not, you may, depending on the patient's body habitus, you might have to take one at the top and one at the bottom with different technique just to be sure that you've got very good penetration and detail on both areas. There should not be any rotation by the spinous processes. They should be midline of the vertebral bodies. So if there is some rotation, maybe the patient's got some scoliosis, maybe their hips are rolled a little bit because their tailbone's uncomfortable, do your best to keep the patient as comfortable as possible so they'll stay straight in where you put them. All right, so your vertebral column should be aligned in the middle and soft tissue bony trabecular detail, and your ribs, shoulders, lungs, and diaphragm in a full field projection is made. Well, I don't know what that means. I'm sorry about that. Collimation is 7 by 17, so we need to see that. But like I said, a marker should be up here or here so that it's up out of anatomy. For the lateral, once again, proper collimation. Your marker can be up here or down here so that it's out of the way. Not in the middle though, because that's where the most kyphotic part of the thoracic spine is. It sticks out the most in the back there. So if you put your marker in the middle, it's likely you're going to get it in the ribs. So at the top or at the bottom is the best place for your marker. And the breathing technique is going to help you see through the ribs and the lungs so that you can see the vertebrae really clearly. The vertebral foramina should all be wide open. The intervertebral disc space should be nice and even and open. All 12 need to be on there. Superimposition of the shoulders and the upper vertebrae can cause the underexposure at the top, like I was telling you, so you may need to do the swimmer's view up there just to make sure T1 through 3 are seen. Ribs are superimposed posteriorly to indicate the patient is not rotated. But like I told you, you can roll them forward just a tiniest bit just to get those ribs superimposed. Semiquantitative grading of vertebral fractures. This will show you what a normal vertebrae looks like and what a mild fracture looks like. Anterior fracture, middle fracture, posterior fracture, and how they grade them here. So if it's a 3 fracture, graded 3 fracture, that's a pretty significant fracture. You can see here how it looks not the shape that it should be. Posteriorly, sometimes this is completely broken off. That's not good either. All right. Here are some of the other things that can go wrong. I showed these similar to you on the C-spine. You can see compression fractures here. And normal disc space, they're good cushioned shock absorbers, just like in the C-spine we were talking about. Degenerative disc, bulging discs, herniated disc, thinning disc, where your cushioning is compressing, and degenerative discs with osteophyte formation. So these are really ragged looking. You're going to see that a lot on older people. You can see where you start to get some spurs and things like that in the front and the back. The patients get pretty uncomfortable. Paget's disease is an abnormal bone growth. So normally bones are going to, the cells are constantly broken down, reabsorbed, and then rebuilt with new cells. And that's a normal process for bone. And when you have Paget's disease, it's incrementally increased. It's much faster. And because it's so fast, it doesn't have time to be strong. And the new bone is weak and brittle and breaks easily. But a lot of times you'll see it and it looks much more dense because there's so much more cell regeneration happening. So it's, even though it seems like maybe new cells aren't such a bad thing, but if it's too fast, it makes the bone weak. Osteoporosis. This is regular normal bone, what it looks like on the inside, and this is what osteoporosis looks like. And you can see it's sometimes very, very gray, like there's not a whole lot of substance to the vertebrae, and they don't show very well. They're just barely above lung tissue here. You can see compared to regular bones. Look how white, how dark it is in the middle, and how white it is circling the edges of the rib. The inside is just like this, hardly any bone left in there. A lot of compression fractures happen with osteoporosis. Typical risk factors are you're female, your weight is low, you're in menopause, you're a smoker because your body's not getting all the oxygenation that it needs. These aren't the only risk factors, and men can get it just like women, but just not as often. So these are just general risk factors. Multiple myeloma, you can see a lot of times they'll order bone surveys out there at the sites, and these are people who need a AP and lateral of everything, and you're going to see it's a bone marrow cancer. It shows up in the bones. It's very, very painful, and there's no cure for this, so people are usually pretty uncomfortable when they come in for these bone surveys. But there can be tumors. It's really important that your technique is good because it helps the radiologist see those tumor growth areas. All right, that's all I have for you with the T-spine. These are some pictures because that last slide was so sad. I just thought these were cute. Cute puppies, sleeping puppies. Anyway, just wanted to end it on a happy note. Look at these sweet faces. So I will see you guys soon, and I'll get the lumbar spine video out this weekend so that you're ahead of things. See you soon.